Hi everyone, my name is Jasmine Jolka and today I'll be presenting on lovastatin and its role in cholesterol biosynthesis inhibition. And we'll go over how cholesterol is made in the body, the enzyme that controls its production, and how lovastatin acts as a drug to lower cholesterol levels in the blood. And I'll also be going over how the drug is activated once it enters the body and the clinical importance of statins overall. And we'll see a few pathway visuals throughout this, and these will help us trace each step of cholesterol synthesis and show where lovastatin works. So let's get started on this slide. What is lovastatin? So it is basically a lipid-lowering drug classified under statins, which are among the most widely prescribed medications for reducing blood cholesterol levels. It's often used to lower LDL cholesterol, which is the bad cholesterol responsible for arterial plaque buildup. And one key point to remember is that lovastatin is a prodrug, and that means when you take it, it's not active yet. The body must convert it into its active form before it can inhibit cholesterol synthesis. And on the slide, you can see the molecular structure of lovastatin. The lactone ring is closed in its inactive form, and we'll revisit the structure later when we discuss its activation. So looking at these photos as well, let's look at the cholesterol biosynthesis overview. This diagram shows the cholesterol biosynthesis pathway, which begins in the liver using acetyl-CoA as a building block, and acetyl-CoA first combines to form HMG-CoA, which then gets converted into mevalonate by the enzyme HMG-CoA reductase, and this step is the rate limiting step, meaning it controls the pace of the entire pathway, and that's why it's the main target for statin drugs. Mevalonate is then converted into isopentenyl pyrophosphate, then squalene, linosterol, and eventually cholesterol. And as you can see in the diagram, this pathway is complex and energy intensive but tightly regulated. So it's highlighted in the image in the HMG-CoA to mevalonate step, which is where lovastatin acts. By inhibiting this conversion, it essentially shuts down the production chain early on. So over here on the slide, you can see how lovastatin works at a molecular level. So the diagram illustrates the structure of HMG-CoA and the active form of lovastatin, which mimics the structure because lovastatin's active form looks similar. It could bind to the active site of HMG-CoA reductase and act as a competitive inhibitor. So this means lovastatin prevents the enzyme from converting HMG-CoA into mevalonate, the first committed step in cholesterol synthesis, and as a result, the liver produces less cholesterol. And because the liver senses this drop, it starts making more LDL receptors, which helps pull LDL out of the bloodstream. And the image here shows the lock and key fit between the enzyme and the drug, blocking the natural substrate from binding. And this is what makes lovastatin and other statins so effective. And over here, we're focusing on a critical chemical transformation. The activation of lovastatin, which when ingested, lovastatin is in a lactone form, which is a closed ring structure. This form can't bind well to the enzyme inside the body. Enzymes in the liver hydrolyze the lactone ring, opening it up into B-hydroxy acid, and this active form mimics HMG-CoA more closely and is able to fit perfectly into the HMG-CoA reductase enzyme. And this conversion is essential for lovastatin to have any therapeutic effect. And the diagram shows both forms before and after hydrolysis, so you can see how important the structural change is. And finally, let's talk about why all this matters. So lovastatin is prescribed to help lower LDL cholesterol, especially in patients with genetic hypercholesterolemia or those at risk of cardiovascular disease. As this slide outlines, the drug helps lower both total and LDL cholesterol, which significantly reduces the risk of heart attacks and strokes, and also preventively. It also uses preventatively for people with high cholesterol but no prior cardiovascular events. And the effect is long-term and builds over time, and most patients tolerate it well with minimal side effects. And